Hi everyone, it's Arian here with Peak Endurance Physical Therapy. In this blog, I want to talk about the pelvic floor and try to simplify it in a way that is easier to understand, because we get a lot of ladies in here as well as men in here with pelvic floor symptoms that don't understand their pelvic floor, have never talked about their pelvic floor, don't know what it does or how it works. So how I often explain pelvic floor to my clients is that it is a muscle. It is a group of muscles, so it functions like a muscle. So this group of muscles works with bladder and bowel function. It helps support your organs. And then it also has a role in sexual function as well. So I want to relate it to the bicep muscle to start here, okay? So in pregnancy, the pelvic floor has a growing role, a growing demand. So as a woman's baby increases in growth, in weight and size, the heaviness or the demand down on that pelvic floor increases. It has a higher demand in supporting the pelvic organs just because of the weight of that baby. So I equate it to the same as like if all my mamas out there are carrying a baby on their hip, right? Their bicep gets tired after a while, right? And then especially as that baby gets bigger and bigger and bigger, it becomes harder. That bicep gets more fatigued. So you can relate that to the same thing as during pregnancy. As your belly grows and as your baby gets bigger, that pelvic floor has a higher demand placed on it to help support those organs. Okay, so that's why sometimes during pregnancy, we can start to see some of those pelvic floor symptoms arise, such as leaking or heaviness or pressure. Now, when we're talking childbirth, if we are giving birth vaginally, that means a baby is passing through our pelvic floor. And during a vaginal delivery, the pelvic floor can have a 250 to 300% stretch during that time. So in essence, our pelvic floor is going through this huge stretch injury during labor and delivery, okay? So if we equate that to, say, your hamstring muscle, right? If we have a pulled hamstring or really stretch our hamstring and we have a pretty significant injury to that hamstring, yes, we would rest it, but we would also then rehab it, okay? It's common sense to us that if we would have a significant hamstring injury, we wouldn't just rest it and then go back to our normal activities and expect it to function as it did before. No, we understand that there will be a time where we have to rehab, build strength back up, and there is this process to get back to its normal function. Same thing goes for the pelvic floor, okay? We went through this huge stretch injury. Yes, there will be some relative rest within there, but if we don't ever rehab our pelvic floor back, we cannot expect it to function like it did prior, okay? So taking those two considerations and just trying to think about that pelvic floor as a muscle group, which it is, there are some different times that we can seek pelvic floor rehab, and it doesn't just have to be related to postpartum. So number one is if people, as far as pregnancy and childbirth, people who are expecting or wanting to get pregnant, we see people before they are even pregnant. They just want to get a jump start on the prehab phase. Same idea as if you're doing a rotator cuff program at the gym. You don't have shoulder pain, but you want to keep healthy, strong shoulders to prevent shoulder pain in the future. Same idea with your pelvic floor. Another time frame is when you are pregnant, okay? We see a lot of expecting mamas kind of throughout their pregnancy, as far as maintaining strength, helping with problems as they arise, making sure that they have the pelvic floor function so that they are ready for childbirth. And then that last time is postpartum, right? You have this stretch injury to your pelvic floor, and now you come back and you are ready to start that healing and that rehab process to get that pelvic floor muscle group back up to par. So I hope that helps to kind of think of that pelvic floor as a muscle group with its own functions versus something that we don't talk about or something that's a little bit of a mystery. It can be easier to understand. Hope that helps.